Hello everybody, this is Miss Smith, and today we're going to be talking about valvular heart disease. So first we're going to do a little anatomy review. So heart valves, the purpose of that is to maintain the direction of blood flow one way through the heart. So you want it to go from the right atrium to the right ventricle to the lungs to the left atrium to the left ventricle and then to the rest of the body. So the valves are going to open and close in response to the pressure changes in the heart, and that keeps that blood flow going in one direction through the heart. So we've got 4 different valves that we're going to talk about. First is your tricuspid valve. That's going to be between your left atrium and your left ventricle. You've got your pulmonary semilunar valve, or sometimes it's called the pulmonic valve. That's between the right ventricle and the pulmonary artery. You've got your mitral or bicuspid valve. That's between the right atrium and the right ventricle. And then you have your aortic semilunar valve, and that is between the left ventricle and the aorta. So you can kind of remember the pulmonic valve is going to be close to the pulmonary artery, and then the aortic valve is going to be close to the aorta. And then you can remember your tricuspid and your bicuspid or your mitral valve. Those are going to be between your atriums and your ventricles. There are 2 different causes of valvular disease, so it can be acquired or it can be congenital. So acquired is going to be when the patient gets it from usually it's going to be from a history of rheumatic fever, but it can also be acquired after any kind of bacterial endocarditis, after a heart attack, or any kind of trauma to the heart. Rheumatic fever, that's caused by untreated or undertreated streptococcal infections, and usually that happens in children. So it can lie dormant in these children for years in either the mitral or the aortic valves, that streptococcal infection. And then valvular disorders are often found when the patient is symptomatic. So they can have valvular disease for a while, and it's not going to show up until they start having symptoms. And then there is congenital, and that means they are born with this valvular disease. So there's 2 main types of valvular problems that we're going to talk about. There's stenosis, and then there's regurgitation. Regurgitation, you might also hear it called insufficiency or prolapse. So all of those terms are interchangeable for regurgitation. So stenosis means that it's too tight. So there's been thickening of the valve tissues. So think of a water hose with a small opening. So there is going to be that water hose is starting to thicken up, and it doesn't open properly. Regurgitation or insufficiency or prolapse, this is going to be when it doesn't close properly, so it's not able to close completely. So stenosis is too tight and regurgitation is too loose. The different types of valvular disorders that we're going to talk about are listed up here. And you can see that there's a lot of mitral valve, stenosis, regurgitation, prolapse, aortic, tricuspid, pulmonic. And we'll talk about a lot of the mitral and the aortic valves, and because they're most affected because of that greater workload on the left side of the heart. So first valvular disease we'll talk about is going to be our mitral valve stenosis. So we know that the stenosis means that it's too tight, and the mitral valve is going to be between that left atrium and that left ventricle. So the leaflets of this valve are going to be stenosed, meaning they are thickening, and that's going to lead to a narrowed opening. So it's going to obstruct or slow down that blood flow from the left atrium to the left ventricle. This in turn is going to lead to an enlargement of the left atrium because it's going to be holding on to that extra blood that's not able to go through that mitral valve into the left ventricle. This can cause that blood to back up into the lungs, and that can cause pulmonary congestion, and eventually it can cause right-sided heart failure. Most commonly, the cause of mitral valve stenosis is going to be from rheumatic fever. Your signs and symptoms of mitral valve stenosis are going to be related somewhat to respiratory conditions because it's going to back up into those lungs. So dyspnea, shortness of breath, cough, hemoptysis, fatigue, that's going to be related to that decreased cardiac output because, again, that blood's not enough blood is flowing from the left atrium to the left ventricle, so that's going to decrease cardiac output of that left ventricle. Palpitations, there might be a flutter or AFib, and that's from that atrial enlargement. They can have some chest pain, murmur, or clicking sounds when you're listening to the heart sounds. Hoarseness, and that's going to be from that atrial enlargement. And then they can also have seizures or a stroke, and that can be from that emboli that can sometimes form in that atrium from too much blood being in there. Because that emboli can arise from the stagnant blood that's left in the atrium. So this next valvular disease, we're still talking about the mitral valve, and this is going to be mitral valve prolapse or regurgitation. So basically what happens is these leaflets of the valve, they're going to bulge backwards into the left atrium during systole. So when the heart beats, these valves are going to bulge backwards into that left atrium. The leaflets may or may not fit together. If they do not fit together, then that's going to be considered your mitral valve regurgitation. So if they do fit together and they're just bulging backwards, then that's going to be your prolapse. So you can see on this picture that I have on here, this is going to be your normal mitral valve when the heart is beating. This is going to be your prolapse, so you can see how they're kind of bulging backwards into this left atrium. And this is going to be your regurgitation. So there's an opening right here where these leaflets are, and that causes blood to flow back into that left atrium. The most common, this is going to be your most common form of valvular heart disease, and it tends to be hereditary, but infections can contribute. So your signs and symptoms, most people are not going to have any signs and symptoms, but if it gets worse, then they can have chest pain, dysrhythmias, palpitations, dizziness, syncope, or maybe a murmur or a clicking sound heard during auscultation of the heart. Specifically talking about mitral valve regurgitation, so this is again where the mitral valve doesn't close completely and it allows some backflow of the blood into the left atrium. This can cause an increase in the blood volume in the left atrium, and that can cause left atrium enlargement. And in order to compensate to pump out more blood, that left ventricle is going to dilate. And then if the left ventricle isn't pumping out enough blood, the blood can then back up into that left atrium again, back up into that pulmonary artery, then to the right ventricle, to the right atrium, and that can cause some heart failure. For your mitral valve regurgitation, the major cause is going to be rheumatic heart fever, or rheumatic heart disease, but also heart attacks, mitral valve prolapse, and infectious endocarditis can also cause that regurgitation. Your signs and symptoms for regurgitation, initially it's going to be asymptomatic, similar to mitral stenosis, but then if you get into the acute problem, it can cause pulmonary edema and shock, and then if it's a chronic problem, it can cause weakness, fatigue, dyspnea, and murmurs. Next, we'll move on to aortic valve stenosis. So this is when stenosis is thickening, and we know that aortic valve is between the left ventricle and the aorta. So this is the thickening of the aortic valve that's between the left ventricle and the aorta. So the valve isn't going to close all the way, and that causes blood to leak back into that left ventricle. This can cause the left ventricle to hypertrophy from that extra blood volume, and then that can cause your decrease in cardiac output. It can lead to heart failure. Causes of this are going to be congenital or the rheumatic heart disease. Your signs and symptoms are going to be chest pain, and that's going to be related to that increased need of oxygen to the myocardium because that left ventricle is working so hard and it's hypertrophying. You can also might hear a murmur. There can be some syncope related to that decreased cardiac output, and then it can eventually lead to signs and symptoms of heart failure if it progresses. Aortic valve regurgitation. So again, we're talking about that aortic valve between that left ventricle and the aorta. And then regurgitation is when those leaflets aren't closing completely and blood is going to back up into that left ventricle. So the left ventricle is going to get overloaded, and that can lead to left-sided heart failure. Signs and symptoms are going to relate to the lungs because it can cause left-sided heart failure. So dyspnea, palpitations, exertional chest pain, orthopnea. You might hear a murmur, bounding pulse, and wide pulse pressure. Next is tricuspid valve disease. So we know that the tricuspid valve is between the right atrium and the right ventricle. So tricuspid valve stenosis, which is what we're first going to talk about, this is going to be extremely uncommon, but it still can happen. So the thickening of the leaflets on the tricuspid valve. So the flow of blood is going to be obstructed from the right atrium to the right ventricles, and then it can back up into that right atrium and cause right atrial enlargement. Your signs and symptoms are going to be related to right-sided heart failure, so peripheral edema, ascites, any kind of swelling in the body. Your tricuspid valve regurgitation, again, regurgitation is when the leaflets don't close all the way and allows backflow of the blood. Usually your tricuspid valve regurgitation is going to be a result of pulmonary hypertension or right ventricular dysfunction. Because remember that right ventricle goes to the pulmonary artery. So if you've got pulmonary hypertension, then that blood's going to back up into the right ventricle and push back on that tricuspid valve. It can cause a volume overload of the right atrium and the right ventricle. Last disease process we'll talk about is pulmonic valve disease. So we know that the pulmonic valve is between the right ventricle and the pulmonary artery. This disease is fairly uncommon. If they have pulmonic valve stenosis, usually it's almost always going to be congenital. The pulmonary valve narrows and then the blood slows when it's being pumped out of the right ventricle. Regurgitation is going to be associated with other valvular diseases. So this can be a cause from other valvular diseases that the patient already has. And that is just, again, regurgitation when blood flows back into that right ventricle. Assessment of your patients that have valvular disease. So first you want to start with their health history. You definitely want to ask them if they've ever had rheumatic fever, because that can be a cause of a lot of your valvular diseases. And then you want to ask about any kind of cardiac disease. So that do they have hypertension? Do they have heart failure? Any other cardiac disease that can cause increased problems? You'll then want to check on their respiratory assessment. So do they have dyspnea at rest or on exertion or when they're lying down? Do they have cough, or are they coughing up blood? What do their lung sounds sound like? Do they have crackles, wheezing? Are they tachypnic? Then your cardiovascular assessment. So listen to the heart. Are there any palpitations? Are there any murmurs that you can hear? Do they have chest pain? Are they dizzy? Are they fatigued? What kind of activity intolerance do they have? Are there any cardiac dysrhythmias? Any kind of edema or JVD that could clue you into right-sided heart failure? Integumentary, you want to check to make sure, do they have any clubbing of their fingers from long-term lack of oxygen? Are they sweating? Do they have any edema? Is their skin cool or clammy or warm and dry? And then are they pale? Then you want to follow with their medications. What kind of medications are they taking? Do they know that they have a valvular disease, or is this a new knowledge to them? And then their coping skills as well. Diagnostic tests that will be done with valvular disease. So obviously we're going to get a chest x-ray to kind of get a picture of that heart. EKG for any kind of abnormal dysrhythmias. an echocardiogram, that is going to be your ultrasound of the heart. And then they might also do a cardiac catheterization just to get a little bit more of an in-depth look if that echo isn't good enough. Medical management for your valvular disease. So there's non-surgical and there's surgical. Your non-surgical is going to be activity limitations, a sodium-restricted diet to kind of control that excess blood volume, diuretics to help get rid of any kind of edema, excess fluid that can cause an increase in the workload of the heart, digoxin or antidysrhythmics if there's any need to increase the contractility of the heart or get the heart back into a regular rhythm. Surgical procedures, so for mitral valve, you can have the open mitral commissurotomy. And basically what they do is they take a scalpel and they just split that mitral valve to open it more so that more blood can flow through. And then there's also valve replacement, so just replacing that stenosed or incompetent valve. There can be heterografts, which would be maybe from like a pig, or there's homografts, which would be from a human. Some nursing diagnoses related to your valvular diseases, and you really need to pay attention to what kind of signs and symptoms your patient is having. So decreased cardiac output can be related to that backflow of the blood in the opposite direction of the heart. So you would want to monitor vital signs, watch their eyes and nose, check their daily weight. You want to promote bed rest. That's going to help decrease that workload of the heart and assist with ADLs if needed. They might also have a high risk for fluid volume excess, and this can be related to failure of the heart as a pump. So you want to watch for that fluid volume. So monitor their eyes and nose. What's their urine looking like? Are they drinking enough water, or are they drinking too much water? Get their daily weights. Are they losing weight? Are they gaining weight? Assess signs and symptoms, so breath sounds, edema, JVD, any crackles in the lungs. And then you want to have fluid and sodium restrictions. They can also have pain related to that decreased oxygen to the heart tissue with an increased demand, so assess their chest pain. Make sure that you're using the 0 to 10 scale. Assess their pain medicine. So are they taking nitroglycerin? Have they had morphine? What kind of pain medicine are they taking? Or do you need to administer some pain medication? And then provide a restful environment with limited activity. So pace activities with frequent wet rest periods in between them. They can also have activity intolerance, and that can be related to that decreased oxygen delivery. So you want to assess their tolerance to activity. So when they're walking around, when they're doing ADLs, does their heart rate increase? Do they get short of air? Do they have chest pain? Are they fatigued? You want to teach them energy-saving techniques. So when they're brushing their teeth or brushing their hair, have them sit down. That can save some energy. Use a shower chair instead of standing up in the shower. And then you would want to help with a daily exercise plan, just so that keeps that patient healthy but not overexerting themselves. And then they can also be at risk for ineffective therapeutic regimen management. So maybe they're just not managing that disease process as well as they need to. And those interventions are really going to focus on reinforcing teaching. For when you are reinforcing teaching to a patient, you want to make sure to explain the disorder to the patient. The more the patient understands what's going on in their body, the more likely they are to cooperate with the treatment of that disease. Tell them what kind of signs and symptoms they will have, and then also what signs and symptoms that they need to report to their doctor. Explain the need to treat strep infections because streptococcal bacteria can cause that rheumatic fever, and then that can lie dormant in that mitral valve or anywhere in the valves in the heart, and that can cause problems later on. The use of prophylactic antibiotics, any kind of surgery that they're having, dental procedures, anything like that, they need to have prophylactic antibiotics, and that will help prevent infective endocarditis. Medication teaching. After a valve replacement surgery, the patient is probably going to be on higher doses of warfarin to thin that blood out to prevent any kind of clots forming. And then if they are on warfarin, then you want to do some medication teaching about that. They're at a higher risk for bleeding. They're going to be on bleeding precautions, so they need to use a soft toothbrush. They need to avoid physical or contact sports, stuff like that for your bleeding precautions. And then you also want to teach them to notify the doctor of valvular heart disease. So dentists, urologists, gynecologists. Urologists, because the valvular heart disease can affect that renal blood flow. And then if the patient has valvular disease and they are pregnant, pregnancy can increase the amount of blood volume in the body, so that can put more stress on the workload of the heart. So they definitely need to let their gynecologist know about that. And then stress the importance of good oral hygiene and regular dentist visits, because if they have any kind of plaque buildup on their teeth or anything like that, it can break off and actually get into their system and cause more problems. That is all the information I have on valvular disease. If you guys have any questions, make sure to bring them to those Q&A sessions that we're going to have, or you can email me.